Hi, I'm Shui. I'll be talking about the Mmse. It is short for Mini Mental State Examination. It is developed for physicians to assess or to screen, not diagnose, elderly patients for dementia, delirium, or head injuries, which means that this is not very good at picking up frontal lobe deficiencies, focal cerebral lesions, and hemispheric problems. So it is influenced upon a few factors, and they include age, educational level, social economic, and ethnicities, especially if their English is not their first language. So it is the scoring system is out of 30, and for someone to be normal, they have to score between 25 to 30. They're considered to be moderately impaired if they're 18 to 25. If they score less than 17, then they are severely impaired. So how does it work? So it consists of 6 components. O for orientation. So this has a scoring out of 10. 5 for time and 5 for location. So time is given as what season it is, what year is it, what month, what day of the month, and what day of the week. Whereas for location, as for you ask them, do you know where we are? Do you know what country we're in? Do you know what state we're in? Do you know what suburb we're in? Do you know what hospital we're in? Then we have registration. Registration is to assess a patient's short-term memory. For example, you ask them to repeat 3 words to you at a time: banana, apple, and yellow. This is to score out of 3 if they get all that correct. Then you tell them to remember those words because you're going to ask them in a minute. Then we have attention and concentration. Attention is assessed by you asking the patient to spell the word world backwards to you. This could be kind of demanding to some patients, and each of the letters that they correct gets 5 points. However, you can also ask them to count down from 100 in sevenths. This could also be demanding, but it helps patients with calculation. Then we come to recall. Recall is to assess the longer-term memory for the patient, and this also gets a scoring system out of 3. Next, we come to language. So first with language, you ask the patient to point to 2 things and identify them. This has a scoring out of 2. Then you ask the patient to repeat after you, and they have to repeat no if, but, or ifs. This gets a scoring system out of 1. Then you ask the patient to look at the paper, which you would have already drawn on the paper. Can you close your eyes? Then tell the patient to follow the demand. This gets a scoring system of 1. Then you ask the patient to write their name in a sentence. This is to test for the fluency of the patients and also the motor language skills. Then you ask the patient to follow a 3-step command and make sure that the patient follows them after you instruction each step, and which means that you can ask the patient to, can you please hold the paper with one hand? Can you fold the paper in half? And then can you put the paper onto your lap? This gets 3 points. Then you can come to construction. Construction is to test for the patient's visual spatial orientation. So this is when a 2 pentagon is already drawn on the paper overlapping, and all you need to do is you tell the patient to copy the pentagon. The patient gets 1 score if all the lines of the pentagons are intact. Now you assess the patient on the scoring. and also assess the patients according to their performance. So in dementia, the onset is usually slow and progressive. There's no certain medications for dementia, and you need to know, and patients usually present with dementia in the early stages by reducing or impairment of the registration. And then afterwards, to lose that is the recall. However, the patient may be slow, but they continue to do the examination until it ends. However, with placido dementia, which is also a name given to depression, is that the patient might not continue, or they may easily give up with the examination. The onset of depression is usually faster than dementia, and the patient may already have personal history of depression. The good thing is that we can give medications to help people with depression. Then we can come to delirium. Patients with delirium usually has impaired function in their orientation. And thank you, and that's it for Mmse. And do you have any other questions,